The individual opinions of previous TIF procedure patients presented in this video do not reflect the opinions of Endogastric Solutions, Inc. and should not be considered as medical advice. Always ask your doctor about all treatment options, as well as their risks and benefits. Only your doctor can determine whether the TIF procedure is appropriate for your situation. While clinical studies support the effectiveness of TIF, transoral incisionless fundoplication, in treating chronic GERD, gastroesophageal reflux disease, individual results may vary. There are no guarantees of successful outcome. The TIF procedure may not be appropriate for every individual, and it may not be applicable to your condition.
I started experiencing symptoms of reflux back in high school. Just started getting frequent stomach pain that I didn't understand. I'd never had heartburn before. I would have a burning sensation all through my esophagus and upset stomach. And after a couple weeks of that, I asked my parents to take me to a doctor to check it out. So we agreed to treat it medically, and we did switch to progressively more aggressive medications to treat the acid reflux. And over the years, it wasn't really keeping up with my activities, at which point we did an upper GI. We also did a barium swallow and a few other tests just to try to rule out more serious issues, and they all came up negative. It was just a very strong case of acid reflux exacerbated by the athletics I was involved in. So from that point, my life was just a series of different medications to treat the reflux. I actually stopped going to a physician after 5 or 6 years because most of the products were available over the counter, and quite frankly, it was a hassle and frustrating to keep hearing the same story. PPIs, no question, controlled the acid reflux the best for me. Being on the PPIs would cause side effects. I had a lot of abdominal cramps. I'd have frequent diarrhea, even some vomiting from time to time, and it just became part of the routine. Regardless of the diet, regardless of the activity, I would feel bloated and have stomach cramps at least once a day with those with PPIs, regardless of which one I took. The burning and pain was powerful enough to wake me up anytime I wasn't treating it properly. And even if I was treating it, sometimes it would kick in. I didn't think I ever would be finished with PPIs. I didn't think that I would ever be finished taking medications to treat my GERD for the rest of my life. One day, I was in the lunchroom at work, and a coworker was talking about his wife's issues with GERD and how she had just had a TIF procedure a few months earlier, and it had changed her life. And my ears perked up. And I said, well, I've had struggles with GERD for 25 years now. I'm interested in hearing more. So what I had done is really just went to the internet like most people do nowadays, researching the physician and the procedure as a whole. I had already said I'm willing to try anything, but discussed it with my family that night and my wife, and we had agreed that we did want to go forward and meet with the surgeon. What really stood out with this procedure was that it's essentially an outpatient procedure. It's minimally invasive. The risks are significantly lower, and the impact on my body and my life is minimal as well. The pleasant surprises since the procedure is I haven't touched my PPIs. In fact, I started giving them away. It's really been easy to manage sleep. Exercising has been incredible. I've been able to swim, bike, or run. Of course, I used to love doing triathlons, and I'd quit doing them because the running gave me heartburn, the biking gave me heartburn, and the swimming gave me absolute worst heartburn. Happy to say, actually, last month I did my first triathlon since the procedure. Just getting back to a normal routine that doesn't revolve around an acids. People have asked me if I would recommend it. because I talk about it a lot. And I absolutely recommend it. And I have recommended it to good friends. And absolutely, it's been a great experience for me.
All surgical procedures have risks. Therefore, it is important to understand the associated risks. Before you decide on a procedure, speak to your physician in detail about the risks and complications that may occur. Expected risks or discomforts as a result of an endoscopic procedure include sore throat, left shoulder pain, temporary abdominal pain which can be treated with standard pain medication, temporary difficulty swallowing due to swelling, and nausea or vomiting. These expected events occur in more than 25% of people who have the TIF procedure. They are usually mild in severity and resolve themselves shortly after surgery. The TIF procedure may be right for you if you are at least 18 years old, have symptomatic chronic GERD, require and respond to pharmaceutical therapy, have a hiatal hernia less than or equal to 2 centimeters, and have a BMI less than 35. The TIF procedure may not be right for you if you have a bleeding disorder, chronic cough, stricture, severe esophagitis, esophageal diverticuli, an obstruction, a paraesophageal hernia, limited neck mobility, osteophytes of the spine, esophageal varices, esophageal infections or fungal disease, or esophageal stenosis. The procedure may not be right for you if you have anatomy that would prohibit insertion of the esophagus device, if you cannot adhere to the post-operative diet recommended for appropriate healing, are under 18 years old, have a hiatal hernia greater than 2 centimeters, have a BMI greater than 35, or are pregnant. Your physician may have other criteria he or she uses to determine whether you are an appropriate candidate. Ask your physician to discuss those criteria with you. To find a physician that offers TIF near you, visit gerdhelp.com. That's GERD help.com. and use the physician locator.